Hello, I'm Dr. Mark Newman, and I want to welcome you back to our discussion about health. We've been talking about the thyroid gland. Remember, we've told you that when you change your health, you'll absolutely change your life, and our goal for you is to add years to your life and life to your years. I want to remind you to join us next week when we talk about more topics regarding your health. Today, let's discuss the differences between hypothyroidism and hyperthyroidism. Remember, hypo, that means that gland is not functioning well. You're not getting enough thyroid hormone production. Most common cause is Hashimoto's thyroiditis. That's an autoimmune problem where the body works against itself. It causes inflammation of the gland, and then the output of the thyroid hormones is not adequate to meet the body's needs. There can be genetics involved, inadequate amount of iodine taken in, radiation, medications can also affect that. Now, usually with thyroid problems, we see a lot more common occurrence in females versus males. We've talked to you before about the signs and symptoms with hypothyroidism. Think of anything that depresses the body's function. So, fatigue, weight gain, and then the inability to lose that weight, which is a big problem with hypothyroidism. Slowdown of your heart rate, depression, cold intolerance, brittle nails, constipation, irregular menses for the females. So anything that depresses or suppresses the functions of the body commonly can be caused by hypothyroidism. Now, how do we find this out? Well, we do lab studies. Specifically, we're going to want to look at thyroid stimulating hormone, message from the brain out to the thyroid. We want to look at T4 and T3. What are those levels circulating in the body? When we do that, that's going to give us a fairly good idea of what kind of dysfunction exists and if it's a thyroid that is at the root cause of it. Okay, let's talk about hyperthyroidism. In other words, an increase of the activity of the thyroid gland, increased production of the thyroid hormones. Most common cause is Graves' disease. Again, an autoimmune problem. The body's working against itself. It causes inflammation of the gland and actually stimulates more hormone production. Oftentimes there can be a genetic proponent or component to that. Swollen thyroid can cause that. Thyroid nodules. The most common signs and symptoms you're going to notice with that hyperthyroidism is, again, an increased inactivity of the body's functions. So, these patients oftentimes will notice a loss of weight, increased hunger, but they can't keep up. Their body is actually working overtime and burning off these calories. Sweating, anxiety, an increase in heart rate, sometimes brittle hair, fine hair growth sometimes can be stimulated by that as well. And an increase in bowel function are the most common signs that you'll usually notice with hyperthyroidism. Now again, how do we find this out? Lab studies. So the studies that we talked about for the hypothyroidism, same things here. We're going to look at thyroid stimulating hormone, T4 levels, T3. We'll even dive in more oftentimes and look at for antibodies, for reverse T3, and oftentimes send that patient out for an exam of the thyroid gland, actually an ultrasound. So there you go, folks. We've given you the comparisons of hypothyroidism versus hyperthyroidism. Hopefully you find that helpful. I invite you to take a look at our website, drmarknewman.com, for all of our blogs, videos, and topics. Give us a like on Facebook. Subscribe to our YouTube channel. Leave us comments, questions, or let us know topics you'd like to hear us talk about. This is Dr. Newman. Thanks again for watching.